Hi, Jody. Well, the Liberals didn't make any campaign promises, any new promises this weekend, but they did plenty of door knocking. And Liberal leader John Hogan says residents wanted to talk about the new Churchill Falls MOU.
On the Churchill Falls deal, they certainly have some questions, and as I said all along, I'm happy to answer those questions, and I think it should be eyes wide open for everybody in this province about what the MOU is and how we still have to negotiate those final terms.
Liberal leader John Hogan says in the first week of the campaign, residents have wanted to learn more about the Churchill Falls MOU and are also focused on things like the cost of living, access to health care, and housing.
Healthcare is always a number one issue. As I say to people, we're so lucky to live in this country with free access to healthcare, but we have to make sure it's good quality access and that it's available to everybody, and we'll continue to work on that.
The first week of the election is now in the rearview mirror. The Liberal leader began the campaign in Labrador, promising a new transformation readiness strategy for the Big Land if the new Churchill Falls deal is finalized. In Labrador City, Hogan also promised housing units for seniors and a new transmission line for the region to access more power from the Churchill River.
And without the power, there's really no point of talking about other mining opportunities. It is really necessary. It is the first step. Make sure that they have the power to develop the mining.
Back in St. John's, the Liberal leader then made promises to help with the cost of living, highlighted by his pledge to cut taxes on residential electricity bills.
And the 10% tax will come right off. So no money out of Newfoundlanders and Labradorians' pockets. In fact, it's an extra 10% every month in their pockets.
Speaking to residents in Grand Falls, Windsor today, they say one issue they want addressed is health care.
Definitely health care. Because I feel like as citizens and as even people of Grand Falls, there's so many of us here who do not have a family doctor.
We got a hospital here that seems like it's I hate to use the word dying, but a lot of things we had to go to Gander, we had to go to Corner Brook or even into St. John's.